Hey everybody, Luke Gordon back with another video on total knee replacement surgery. And in this video, I want to address a question that I don't really get this question too often, but it comes up in my mind a lot when I'm working with clients with total knee replacement. And that is, should my PT be massaging my knee? And it's really kind of a loaded question because there's lots of physical therapists that will just say, oh no, you take your client through the exercise program, you do their knee flexion stretches, their knee extension stretches, you do like the quad strengthening and the hip strengthening, and then you progress to more dynamic balance. And, if you do any, manual therapy or hands-on therapy, it's typically going to be like stretching. And that's fine. And I think to some extent that works with like an easier, less complicated client with a total knee replacement surgery. But really, I don't agree. I think personally, again, my personal opinion, and if you're a PT, feel free to disagree with me. I'd love to hear from you. I think your PT or your PTA, whoever you're working with, should be massaging your knee. And I'll tell you why. I think because, and especially with people who are very motivated with doing their home exercise program. So I should probably throw that little caveat in there, is that if I'm working with a client and they are very clearly, fully engaged, fully invested in their recovery, they're doing their stretches, they're pushing it, they're doing everything I ask them to do, I don't really feel the need to watch them do all their exercises in the clinic. And in the clinic, what I want to do is things that they can't do for themselves at home. So again, with a client who doesn't really do their exercises, or for whatever reason, maybe there's some cognitive issues there, but I don't see that very often. Most of my clients want to do everything they can after their knee replacement surgery to get it going. And so I'm like, okay, well, let's, keep doing these stretches. Again, I don't feel like the need to watch you do your stretches in front of me as long as I feel like you're doing them correctly and you're holding them for as long as I want you to hold them and things like that. So what I can do for you manually, meaning with my hands, is I can stretch you, of course, but I can also massage your knee and do any number of other like massage techniques or manual therapy techniques to decrease your pain, which is huge. If you've had knee replacement surgery, there's lots of pain, and decrease your swelling, which is also huge, because if you can get the swelling down, guess how much easier those stretches are. When you're trying to bend your knee and you're doing my favorite stretch where you've got your foot on the staircase and you're like leaning forward, bending that knee, what are you hitting up against? What's limiting your ability to bend your knee from 100 degrees to 110? It's usually swelling. It's swelling and pain. So again, if you come into my clinic and you're fully engaged, you're doing your homework, I'm happy with your technique and your form and all those things, and I think you're doing well, I'm going to spend a good chunk of your treatment doing massage techniques. I'm going to lay you on your back, I'm going to elevate your leg up in the air, and I'm going to work on getting some of that fluid to drain back down, towards your groin and towards your core, so it can just get out of your knee. If you have like soft tissue pain, like your quad is painful, the inside or outside of your knee, any of those soft tissue structures, if they're painful, I'm going to do what I can to get rid of that pain for you. And again, there's any number of techniques. It might just be a simple massage technique. It might be like an instrument-assisted technique where I'm doing like some scraping massage. There's therapists that do myofascial release and strain counter-strain. I don't really care what the technique is, because again, the question is, should your PT be doing massage or manual therapy? And my answer is yes, they should be. If you're seeing a PT and they're simply taking you through exercises that you're already doing at home, in my humble opinion, as a PT of 15 years with a little bit of perspective, I think you're being underserved. One last thing I want to throw in here before I let you go on this video is that a good lens that I put this through too is I say, what if you were the knee surgeon? What if you were a big deal? What if you were a professional athlete? How would I treat you then? I'd be like, oh, okay, come on in, Dr. So-and-so, Dr. Gordon. We're just going to have you go through your exercises. I don't think so. I think you're going to get VIP treatment. I think you're going to get massage. You're going to get taping. You're going to get everything I can possibly throw at you. And I'm going to make another video following up this one is, what do you think I'm going to recommend you do in terms of your treatment frequency? Am I going to say, oh yeah, just come in twice a week and we'll get you going? You know what? If you're a professional athlete, let's say, and I don't know, pick your favorite professional athlete, basketball, baseball, football, soccer, whatever, and they have a total knee, and yet they're still performing in some level, which is unusual, but just bear with me here, okay? How often do you think they're going to PT? Are they going twice a week? Probably like 5 times a week, right? We're probably going twice a day. So again, stretch your thinking a little bit on this one. VIP treatment. If you were a really important person, which you probably think you are, and you probably should think that, what kind of treatment would you be getting? Would you be getting the generic, oh, come on in, you know, do this, do that, everything you're doing at home. I'm just going to watch you do it, and then I'm going to put some ice on your knee, and you're doing great. Or are you going to get everything they can throw at you in terms of massage, manual therapy, all those good things? So anyhow, video's getting longer. That's my impression. I would love to hear from PTs on this one. If there's any PTs that watch my channel disagree with me, I would love to hear it. I feel pretty confident, or I feel pretty passionate about this one, though. You should be getting manual therapy if you're having a total knee replacement. Even if you're doing really well, you should be getting it because it's the best way to optimize your recovery. So let's leave it at that. Thank you for watching. Please like and subscribe before you go. If you liked the video, please leave me a comment. If you didn't like the video, that's fine too. Leave me a comment if you want. I'm not a big believer in negative energy, but do whatever you want. Anyways, thank you for watching. I'll see you next time.